So I'd like to invite people to an event to come along to our endometriosis education evening. It's on the 2nd of September. Myself, I'll be talking about endometriosis, dysmenorrhea and causes and treatments. We also have a dietitian, Nikki, who's focused on how the diet and the gut impacts abdominal pain, including endometriosis. We have Jess Cunningham. She's our physiotherapist who has a passion for endometriosis and pelvic pain. The muscles of the pelvis and the abdomen have a massive impact on pain, and you can treat the endometriosis, but if you don't treat the muscle spasm, the pain is still there. So her role in the management is extremely important. We have Ali Shepherd. She's our nurse practitioner. So we recently acquired Ali to work in our practice. She sees the patients who have a flare of pain or difficult symptoms and can't get into their GP. She has a passion for endometriosis as well. We also have a psychologist, Maggie, so she's going to be there to talk about how the brain impacts pain and how to manage just dealing with endometriosis and what it does to anxiety and just body awareness. And then we also have Vanessa Tatum from Janaea, who's going to talk about fertility. When women come to my room, one of their main concerns, even at a young age, is, do I have endometriosis? Will I be able to have a baby? So Vanessa's going to talk about fertility. If the period or abdominal pain is controlling someone's life, what ends up happening is young girls, they miss school. They can't work their part-time jobs. They don't get into the university courses that they want, or they end up missing too many classes, and it has a massive impact on their life, and it shouldn't be that way. So what we need to do is focus on optimizing their pain and their periods to the point where they're not missing out on things, and so this condition doesn't control who they are. So my idea was, let's get that information out there, possibly in a better way, where people feel comfortable and in an environment that they get time to contemplate. And so that was where it came from, and we're hoping that it goes well. Anyone who thinks that they'd like to understand what a multidisciplinary approach to endometriosis management looks like, and if you know someone who's suffering each cycle or who has problems that you think that they could find our information useful, bring them along or refer them. It's open to anyone.